This is Guided by Wellness with Dr. Magnus Thorsson, your source for clarity on the science of cannabis wellness.
Surgery offers immediate transformation, not just in appearance, but in confidence, comfort, and quality of life. Yet, recovery is never just physical. It includes pain, sleep disruption, and emotional adjustment that are all part of the journey. What if cannabis could be part of the toolkit, easing recovery, reducing reliance on heavy medication, and helping patients build a healthier, sustainable lifestyle after surgery? In this episode, we sit down with Dr. Jonathan Brower to explore how surgery supports cosmetic, physical, and mental well-being, the role cannabis can play in post-operative recovery and comfort, and why cannabis may be a powerful ally in weight loss journey and long-term lifestyle maintenance. Today, we're shifting the conversation to the recovery room and beyond. From pain management to emotional balance, cannabis is emerging as a tool that can complement surgery and support patients in maintaining their wellness long after the healing is complete. With us today is Dr. Jonathan Brower, a Providence-based board-certified plastic surgeon who believes surgery should be approached as part of a whole person wellness. I'm so pleased to welcome my guest, Dr. Jonathan Brower, to talk about his practice and relations to cannabis. So my first question to you, as I ask most people who come on, is could you please introduce yourself? What is it that you do? And how did cannabis enter into your frame of work?
Well, thanks for having me, Magnus. I think this is such an important topic. Again, my name is John Brower. I'm a board-certified plastic surgeon with a primarily cosmetic practice in Providence. I do all sorts of cosmetic procedures. I have a special interest in plastic surgery after weight loss, which is about 25% of my practice, but the rest of my practice is a variety of aesthetic surgery of the face, the breast, the body, operate on men, women, younger people, older people, the true variety of plastic surgery. So I came upon cannabis as a potential tool for post-operative pain management. Actually, it was brought to me by a patient who worked for a grower just sort of during the time that cannabis had been recreationally legal in Massachusetts but was not yet recreationally available in Rhode Island. It was medically available only. And of course, at that time, it was very complex to obtain designation for medical prescribing. And actually, it was a patient at the VA. It was a veteran. I was on staff at the Veterans Affairs hospital. And it came to me in that the patient was a grower and interestingly had had a history of chronic pain that spiraled into opiate use, abuse, addiction, and that took on a life of its own. And, tales all this time with veterans having a difficult time with sort of readjustment to civilian life. He came back from his time abroad and was not able to re-enter society the way that he had planned, and addiction took over his life, and he was able to manage his chronic pain with medical cannabis at the time, and it inspired him so much in the way that it changed his life and helped him turn his life around, that he actually entered the industry himself. So that was a pretty powerful early introduction in my practice to the benefits for someone who has chronic pain to be managed with frequent cannabis use, and it made him a productive member of society. I thought that was really amazing.
Yeah, it is, and it's interesting as I hear you talk about his opioid use. What we're seeing in states that are legalizing cannabis recreationally, we're seeing that deaths from opioids are reduced as a result of legalization. So, yeah, that's an excellent story. Thank you so much. So, how do you see as part of an overall wellness regimen?
So surgery, we say that plastic surgery is surgery of the soul. I'm a part-time surgeon, part-time therapist. There's a box of tissues in my consult room because it's often a series of very emotional, difficult experiences in self-exploration or relationships that lead somebody to ultimately pick up the phone and call me and then go so far as to schedule a consultation. There's the overall wellness of seeing you're changing something about yourself that bothers you. Maybe it reminds you of a troubled relationship in the past or a difficult time in your life. Many of my patients have been obese in the past, and that was something that had a time for them. And so they are seeking my care to move on to the next chapter in their lives. It's sort of the next step in their journey. They find that they're not able to really move on from their obesity and the difficulties in having been obese until they remove the stigmata of obesity. In that case, typically is a lot of excess skin sort of all over the body. So helping them kind of cross that finish line, they have been pat on the back by their primary care doctor because their diabetes has improved, their blood pressure is normal. They've come off all these medications, but they don't feel good about themselves. And so I have the privilege of walking them across that final sort of conclusion of that journey for them and onto the next phase of their life where they can be more present and feel better about themselves.
That's great. So that's an interesting two-sided way of approaching somebody's health. That's really interesting. So what are the biggest challenges that patients face during post-op recovery, both physically and emotionally? And I was interested in, how does cannabis help with both the physical and the emotional recovery?
Sure. So it's a huge transition for patients, right? I mean, there's always a period of time in about 2 or 3 weeks where patients start to say, what the heck did I do to myself? Why did I do this? Because it's real surgery and it requires a recovery in patients, and people want these immediate results, and it takes some time. There's a fair amount of anxiety that comes with it. People have invested a lot of time, money, energy. They've taken time off of work. They've arranged childcare or other care for pets and that sort of thing. And so they are putting a lot of pressure on themselves to recover as quickly as possible. They are on a very strict post-op pain medication regimen, mostly non-opiates, although I do make them available to them. And so managing their pain is kind of step number one. When patients' pain isn't controlled, they do things like they don't take deep breaths, they don't cough normally, they don't walk enough, and then that sets them up for all kinds of other much more serious medical complications, things like blood clots or pneumonias, because they're not kind of up and mobilizing. They're laying in bed, kind of convalescing, which is every plastic surgeon's worst nightmare. We like our patients sort of up out of bed, taking it easy, but having sort of a normal routine for the most part. Conventional opioids fall short in that they just kind of, in my experience, leave patients a bit sedentary, and they're not able to make sure that all of their systems are functioning the way that we would like them to. You mentioned sleep. I think sleep is an enormous part of it. What we do know about sleep and pain is that when patients aren't sleeping, or when their circadian rhythm or sleep cycle is somehow disrupted, the perception of pain is much more significant. We think about the chronic pain syndromes or inflammatory pain syndromes, things like fibromyalgia. We know there's an enormous correlation between severity and presentation of fibromyalgia and things like insomnia or otherwise disrupted sleep. So there's good evidence to support that if you just use cannabis for regulating the sleep-wake cycle, and that alone will improve someone's pain and ultimately allow them to be more mobile and avoid some of these more complicated, more serious downstream complications of surgery.
So cannabis sort of creates a framework that helps the recovery, or makes it possible. What we're discovering also with the multiple cannabinoids, for example, CBN, which is often prescribed or recommended for people who have a problem with sleeping, doesn't help them, doesn't sedate them, doesn't help them fall asleep, but it helps them be still during their sleep. So there's an enormous arsenal of interesting things that you can find in the cannabinoids that can help, if you know how to guide it. So yeah, thank you for that. Now, so we talked about sleep and opioids. Where do you see cannabis fitting into the recovery process when it comes to pain relief and inflammation?
I think it's something that I recommend routinely, and more of my colleagues are doing the same. I think there's a relatively slow uptake only because of it's not as tightly regulated as some of the other medications that we use for post-op pain control. But for patients who are having routine cosmetic procedures, or if they're familiar with these cannabinoids recreationally, they're much more comfortable doing it. And they're taking like no oxycodone. They're really just managing it on their own with their edibles at home, and they're doing great. I think we've got a long way to go in the medical community to outright recommending it. I'm in sort of a privileged space because I'm in a private practice. I'm a solo surgeon. I don't have a fear that anyone is looking over my shoulder and telling me that I shouldn't be doing this. It's safe, it's legal, and in my experience works well for patients and expedites their recovery. That most doctors, most surgeons are not in that kind of arrangement, so they are a little bit more apprehensive to be a little more creative with how they're helping patients manage their pain.
Right. Yeah, and the private practice, because I had a physician on a few episodes ago, and we were talking about minimum effective doses, and we were talking about medical school. The endocannabinoid system is not really discussed in medical school, and it's sort of kept out of the textbooks. So it is that is a big hurdle. But let me ask you this. So many, as you mentioned earlier, many patients experience anxiety, the box of tissues, and now, how could cannabis help with the emotional recovery and support patients after surgery?
Yeah, I think that sleep is a huge part of it, right? If patients are ruminating at night, their anxiety over whatever post-op experience they're having, or thinking about sort of their obligations outside of their recovery, if we're able to just get people to focus on their recovery by regulating their sleep-wake cycle and minimizing anxiety while they're recovering, it's just so much more effective, and they can focus on themselves and what they need to do to follow post-op instructions and get where we need them to be.
Right.
Sometimes they get in their own heads and make up then they go on Google and they're looking up worst case scenarios. They're going on social media and finding people who have had horrible complications or experiences elsewhere. I just want them to be present and focused on themselves and following our instructions and putting one foot in front of the other. And I think that keeping people comfortable, keeping people's anxiety managed, helping people sleep is just so important. And to get them where we need them to be.
So, in thinking about that, what someone who comes to you and is requiring surgery and may never have used cannabis before or not in many years, how do you start that conversation?
Yeah, it varies dramatically. There are patients, I bring up the conversation at the consultation because one of the most common questions that I'm asked is sort of how painful is this going to be and what's my pain control plan. And, what I tell them is that I use multimodal analgesia, which means I use different medications that work differently to treat pain. And some are more effective for others in different people. And so you use them all. They're all fairly well tolerated and inexpensive with few side effects. and they're effective. And so cannabis is just one piece of that puzzle. For people who use it regularly, either recreationally or for sleep or for anxiety or for pain, it's easy. They're like, great, love to hear that, happy to do it. There are people who have relatives more and more. It's a little bit of a flywheel because they have relatives who more and more are getting through surgery and have had a major abdominal or chest surgery and were able to recover quicker and more easily because of their use of cannabis. And so people have said, oh yeah, my Uncle Bob had a piece of his lung taken out and did great with cannabis afterwards, and they're a little bit more open-minded about it. So that conversation is shifting a little bit. I'd say it's the minority of people, 10% or fewer, who are like, I would never do that, or I tried that once and hated it. And then I just kind of leave the conversation open and say, not all cannabis is equal, and people have different experiences, and it's a lot more controlled now, a lot more dose controlled. And so I just encourage them to have an open mind. I'm not going to force anybody to do anything they don't want to do, but I just kind of make it clear that it's something that I'm okay with, even encourage.
Yeah, and because, if somebody tried cannabis once and said I didn't like it, that's like saying, have you ever tried food and I didn't like it? Well, there's many kinds of food.
Right.
So, but that brings me to ask you this. How about available information? How do you find, as a physician, the availability of useful information for you as a professional to be able to guide someone who is new to cannabis or returning?
So that's that's one of the challenges in that you go to our academic journals, or I go to my professional society meetings, and there's no discussion of this, and that's because my personal view is that the people who are contributing to the scientists, the researchers who are contributing to the body of literature are parts of institutions, and those institutions really control, or at least have an influence in management of patients. And I think that when it comes to presenting, pure scientific research, everybody wants to see a randomized control trial or some sort of very high level, and that, of course, I would love to see that as well. That just requires a significant amount of buy-in from the institution, because the Institutional Review Board needs to approve these research studies, and informed consent needs to be obtained. And I think part of me thinks as a society and as these large institutions, they're just not quite there yet in terms of producing what we consider in the medical community to be really credible information. And so that's the challenge. And a lot of my guidance is anecdotal, based on what other patients have told me and what I've observed other patients have experienced, and how they're doing and how they're managing their pain, what their pain regimen is, cannabis or not. So that's the challenge. I think that's the next frontier, is getting some really good randomized control trials for use of cannabis in the post-operative period. I guide patients to the dispensaries because my experience with that guidance is that patients say, I went to this dispensary, had never been there before, or maybe I have. I told them what you said, what my surgeon said, and they were like, sure, here, this is exactly what you need. And 100% of the time, in my experience anyway, they've had a great response and a great experience with it.
That's very good. That's very good, because as you point out, first of all, we don't have randomized trials. We have the dearth of literature, and most universities who receive federal financial support cannot risk losing the federal support, so they won't touch it. My university, for example, we grow tomatoes and collas because we can't grow even hemp. So they're very risk averse, number one. And number two, we lack the foundational knowledge. Like, so many physicians and scientists have not been sort of made aware of what the arsenal of opportunities here are. So let's see. If you could give one piece of advice to a patient considering cannabis as part of their recovery lifestyle plan and lifestyle plan, what would it be?
So, coming at this from a surgical perspective, I would say two things. One, as I said earlier, keep an open mind, right? Because, like you say, not all cannabis is equal. You can't try it once and write it off entirely. It's important to be open-minded about it. I think that's number one. Number two, I think that patients should be candid and transparent with their cannabis use, because the one piece that we've not discussed yet is how cannabis pre-op changes an anesthetic plan. So, for example, patients who consistently use marijuana or any of the cannabinoids recreationally before surgery, their anesthesia requirements will be significantly different during surgery. So that's very helpful to know from an anesthesia perspective. It's just a planning point, so that the anesthesia provider can properly maintain not only hemodynamics and keep you safe during surgery, but also control your pain during and after surgery. So it's not a secret. This is it's important for complete transparency from patient to doctor on all substance use, as mild or concerning as it might be for the patient.
Yeah, I've been asked those questions before by an anesthesiologist before procedure. Come on, tell me really. On the weekends, not a little bit? What do you do? Tell me, give me all the details.
It's not meant to be a gotcha. It's meant to be how can I make sure that I keep you safe, and I need to know all the information, right?
Yeah, exactly. No, I knew that. But it's just interesting because, usually when a physician asks you a question, you answer them. They're like, okay, thank you. Or that's good. But in this case, it's, no, come on, really tell me. Come on, really level with me. So anyway, I thought that was funny. So there's one thing that we do that I try to do with my guests every episode, and that is a little bit of myth busting. Because as we well know, there's lots of misinformation, misconceptions about cannabis. And I wanted to talk to you, and obviously we've been talking about, the application of cannabis in medicine, but the myth is cannabis has no real medicinal use. It's just for getting high. So we've heard that drummed in us for years. What do you say to that myth?
I say that my experience and the experience of thousands of my patients says otherwise, because my patients are recovering faster with fewer side effects, fewer opiate use. I have zero incidence of opiate dependence in any of my patients. They're eating, they're getting their nutritional requirements met after surgery. They're not getting constipated, they're sleeping well, they're up and around, they're avoiding complications, and I attribute a lot of that to the integration of cannabis into their postoperative pain regimen. And I think that the future is bright for the use of cannabis in modern everyday medicine as we learn more. And I think that, like we've said, the randomized control trials that I hope will one day come will give the average employed physician, the average surgeon, a little bit more comfort with integrating into their plan, so that we can keep people safe and comfortable after surgery.
Yeah. Okay. Thank you for that. One thing I want to ask, just that paper that I shared with you, quite interesting. The results of THCV and CBD together. Although the sample size was very small, only 44 people, but the statistical significance of the study showed that cannabis can also be used as a appetite suppressant. And I think there's lots that we can do with that as we move forward. And I thought immediately of you when I read that paper, because I know you focus on the whole patient wellness. It's not just about the surgery. It's about how can I make my patient feel good. And often people worry. I've heard people worry about, gaining weight again. So it looks to me that with some development, we're going to have tools to help people manage their weight gain moving forward. So it's very bright, as you said. So.
Yeah.
Well, thank you very much for taking the time to speak with me. I really appreciate it. Thank you again.
My pleasure. Thanks for having me, Magnus.
The reality is that cannabis contains multiple cannabinoids and terpenes that support post-surgical pain relief, reduce inflammation, improve sleep quality, and promote emotional balance. Within the experience framework, many of these benefits are found in the wellness category, with products less than 10% THC. Light or lower dose balance products are designed for healing, recovery, and sustainable wellness. Far from being just a recreational, cannabis can be an intentional tool in medicine and long-term quality of life. Key takeaways from today's conversation with Dr. Brower: recovery doesn't end when the stitches heal. True healing is about restoring confidence, maintaining balance, and living fully. Cannabis can complement surgery as both a recovery aid and a wellness tool for the long. Just to recap, surgery can change the way someone looks, but cannabis may help to change the way they feel and the way they heal. By easing discomfort, improving sleep, and supporting emotional wellness, cannabis can make the recovery process smoother and the long-term lifestyle more sustainable. Thanks for joining me on Guided by Wellness. Understanding how cannabis fits into surgery recovery expands our vision of wellness, from pain management to lifestyle transformation. With guidance, intention, and education, cannabis can become a safe, effective part of living well after surgery. Next time, we'll explore the science of cannabinoids like THCV and their potential role in weight management and wellness strategies. Have you or someone you know used cannabis to support healing or recovery? Share your story with us. It may inspire others exploring the same path. Until next time, stay curious and keep guiding with wellness. Thank you.
Thanks for watching Guided by Wellness. Don't forget to like, comment, and subscribe, and we'll see you next time.